Okay, hi everyone. Thanks for joining. Thanks for taking the time to participate in this webinar that we've organized. This is a great pleasure for us to have our colleagues from Doctors Without Borders Austria here with us, explaining us in more detail the work that they've done in the Ukraine, what's happening on the ground. It's always a great pleasure working with them. For those of you who are aware of how the Staff Council does its charity work in general, we always look to find one of the major project implementers on the ground in whatever charity we do. We never decide on ourselves which project to get involved with. We always rely on our constituencies, on the union to come to us, to ask us for help, to solicit support. In this case, of course, it was the VIC Ukrainian Club, who is chaired by Solomiya Omeliyan, who is also here with us today, who will say a few words. And together we came up with a plan, how we will collect funds for this humanitarian crisis and how we're going to implement it. The three major project partners that we chose were Doctors Without Borders, who are here with us today, the Austrian Red Cross, who will be talking tomorrow, and then we have Caritas as well. It is important to say that we only do cash collections. We centralize it through our accounts, which are annually audited, of course. We have an audit trail for everything. We issue invoices for anybody who requires one, and then we transfer the lump sum to that project executor. We have a long-standing relationship with Doctors Without Borders Austria, as I've been working with Otto for a long time. We trust their work, and they've done exceptional work for us over the past. And we're confident that what they will tell us today will just add to that. So without further ado, please let me give the floor to Solomiya, who will also say a few words on behalf of the VIC Ukrainian Club.
Thank you very much, Stephen. First of all, I would like to address our dear representatives of Doctors Without Borders Austria team, and all colleagues who have joined us today and who will listen also to this webinar later on, and to express my great pleasure to welcome you all to this webinar in my capacity of the president of the Vienna International Center Ukrainian Club. And first and foremost, I would like to express our sincere appreciation to Stephen Eels, President of the UNIDO Staff Council, for his amazing support in organizing this meeting that aimed to present the results of the campaign, Humanitarian Relief for Ukraine, that Stephen has talked about. And overall, I would like to take this opportunity to thank every individual who has generously contributed funds and efforts to support the relief projects in Ukraine. We say that every euro matters, every act of support matters. Solidarity is here a key to keep vital help continuously being channeled to the people affected by the war in Ukraine. To me, as probably to every Ukrainian, it is extremely great honor to interact with our friends and partners around the globe. Our friendships have proven to be of extremely great value, and we appreciate them a lot. Our club's key goal is to promote the Ukrainian culture and raise awareness of international audiences about our history, national heritage, Ukrainian language history, and all that is so important during the peaceful times. However, now in these very different times, our priority and our key task as an individual or as a club member is to provide as much as possible support to help people affected by the war. And that also includes humanitarian relief. We are therefore extremely grateful that in response to our call for help the UNIDO Staff Council immediately responded and launched this initiative. It allowed us to collect funds and support those in need. And this effort continues as we speak. During these days, every one of us, I'm talking now about Ukrainians, have experienced personal revelations and impressive manifests of human kindness. It helps us a lot to heal the devastation and reduce pain that accompany us during these days. Thus, it is absolutely remarkable what our colleagues and friends around are doing to help. They give shelter in Austria and other countries to the people fleeing the war. They provide medical services and assistance. They provide food, psychological support, and financial relief. I just take this opportunity to thank you all once again for your amazing efforts. This will never be forgotten. And I really look forward to our discussion today. We are very interested to hear about what your organization, Doctors Without Borders, is doing. And we look forward to continuing our cooperation with you. Thank you. Stephen, back to you.
Thank you, Solomiya. Very powerful statement. Okay, Otto, so the floor is yours. Please let us know what you have for us today.
Yes. Thank you, Stephen. So first, I would like to thank you, Ms. Omeliyan, and all the people, all the Ukrainian employees that are so much helping their friends and their local people, and that every euro is really counting. And I can tell you that we will really take care of every single euro, that most of this euro is going directly to the patients. And at the end of Louis' presentation, I will tell more about how we use the money, which is trust in principle for us. And we are really respectful and very thankful for every single euro we get. So thanks, Solomiya, for your engagement, and all the engagement, all the people you are representing are doing. And I would like also to thank Stephen, not only for organizing this today, but also for now 25 years of cooperation between UNIDO and Médecins Sans Frontières, Doctors Without Borders. In 1998, it started. And I know Stephen now for 9 years, because I am just 9 years here in the fundraising. So Stephen, and thanks a lot for this very trustful cooperation. And my name is Otto Andre. I'm working here in fundraising. So I'm the one that is taking care that the money is good used. And I work just 2 days for Doctors Without Borders, and 3 days per week I work as a psychotherapist. And psychological help is also a big topic and a big effort for us. And Louis will talk then more about it. So finally, I would like to introduce you to my colleague, Luis Villa. I'm really very glad that he has taken today his time and also the preparation of the presentation, because it's a challenging situation for us. Luis is a public health doctor, and he is more than 15 years now working for Médecins Sans Frontières in the field, in the headquarters. So he's really a very experienced manager and colleague. And he is heading here in Vienna in the Taborstrasse. You're all invited in the Taborstrasse. Just phone me and come. At least you get the coffee and a nice talk here in the 2nd district. We are sitting here. And Louis is heading this operational support department, and is now directly engaged in the Ukraine mission. So Louis, again, thanks for your time. And I'm glad to have you. And I am now handing over the floor to you.
Thank you. Thanks, Otto. Now, thanks especially Solomiya and the colleagues in UNIDO for organizing all this, and Steve to give us the opportunity just to present you and to have a chat with you on what we do. Part of what we do could be a long list, so just try to be brief and then leave more time for your questions or our discussion together on what we are doing in Ukraine, neighboring countries, a little bit in Austria. So as you know, MSF is a humanitarian organization. We specialize in medical aid, so we support normally health structures in times of crisis, and we have a number of activities that we just put in place after the crisis started, and before we were working on regular programs. So we will talk a little bit about that in Ukraine and neighboring countries as well. So it wasn't a complete new situation for us. We knew the country, we knew the health facilities. We had some programs running normally or the normal programs were on supporting the national health system on HIV and TB, multi-resistant TB treatment, and HIV/AIDS and co-infection of HIV/AIDS and tuberculosis treatment. And that gave us some knowledge and the connections already in the country to launch the humanitarian, the emergency response. And we will talk a little bit about that now. So Steve, there's a presentation just so you don't have to look at me all the time. You see we put a few slides, just a few together. So we're going to talk a bit about, again, Ukraine, exactly what we do in Ukraine, our response in Ukraine, our response in neighboring countries as well, mainly supporting also the refugees and that have crossed to neighboring countries. I'll talk a bit about challenges in this type of response, and then as in Austria, what we have done here also, just to try to find out about unmet needs and what we found in general, also in the response, as Solomiya was saying, in the hosting of the people that are crossing the border and are normally supported in Austria by different organizations. There's a couple of needs that we found that we will talk about them. The rest we found that they were quite well covered. So the main response was inside the country, neighboring countries, but in Ukraine is obviously where the biggest need is. Can you move on to the next one, please? So as I mentioned, we've been in the country since '99, so quite a while now. Today we have, including the staff that is working in the response, almost 200 staff. There is, counting international staff, we have also 300 plus Ukrainian colleagues working with us. The Ukrainian colleagues are working in health facilities as well as doctors, nurses, but also as logisticians, administrators. So we know all sorts of jobs just to support the operations in the country. And then we have also set up some operational centers in the neighboring countries, some of them to support those countries in the excess of need that they have with the people crossing the border, but also to help and to support the operations in Ukraine, mainly with supplies, facilitating the receiving and moving into the country supplies for hospitals and health centers. When we look at the numbers, I mean, numbers just only tell us, the magnitude of the story. Of course, we don't have the individual stories that are key to understand what is going on. But just only when you look at the numbers and the amount of people that have been affected by this crisis is just quite staggering. It's the people that we know of that they have moved outside the country, and we see in the news, but also there's a lot of people inside the country, displaced populations that are also in dire need of health and of health support and health assistance. And there's also a lot of people, as you probably know much better than us, than haven't moved. They decided to stay in their countries, in their cities, and they are also suffering in many ways. And we are going to talk a bit about how we are providing some relief, some support for them as well. So we have people that have crossed the countries, as you know very well, working for the UN once they cross a border, international border, they are recognized as refugees. They get the refugee status. And then we have what we call displaced populations, which are those groups of people that suffer the same consequences and the same needs as refugees, but having crossed that international border, and they remain inside Ukraine. And they are also considered as, as, again, they don't have all the benefits of refugees, but they are considered as high-risk populations in need, and we provide some of the health response to them as well. Next one, please. This is I can show you a more detailed one, place by place, but it will be a bit cumbersome. So we just kind of try and highlight what are the main places where we are working now. In neighboring countries, the neighboring countries, although if you see only one dot, it's just signifying that we are in that country, but there will be a few small dots on the specific operations. When you see the OC, it means operational center. And then when you see the A, P, B, these are the operational centers. We have 5 in MSF. So there's 5 operational centers that we call them operational centers because there are the ones that can decide in the whole MSF movement. They decide on where and how to do the operations. And they are Belgium, so OCB will be for Operational Center Brussels in Belgium. OCP will be Operational Center Paris in France. OCA Operational Center Amsterdam, which is Holland. And OCBA is Operational Center Barcelona, Athens, is a combination of Spain and Greece. And these 5 operational centers, they have, that's how we divide ourselves. Depending on the needs, we decide as a movement to intervene in different places, depending. Each operational center we all work more or less in the same way, but sometimes an operational center specializes more in some type of response. It could be surgery, or it could be set up a hospital, or it could be primary care, or it could be HIV, or it could be TB. So depending on the needs, we decide which operational center is better suited to carry out that specific operation. And then there are some times when we have 2 or 3 working together, just if the needs are too big, or if there are more than one thing to be done, which is in this case, there are so many needs that we need the operational centers working together, trying to cover as many of them as possible. Next one, please. So our main support is to health facilities. So in situations like the one the Ukrainians are suffering now, basically the need is for, from a medical point of view, I'm always talking, is always medical supplies for the hospital, supporting the health structures that normally are both overwhelmed, and sometimes, as you know, they have been targeted or they have been damaged by the conflict themselves. Also because some of the staff are unable to work for different reasons, and you have a combination of lack of supplies, lack of health staff, and health facilities that cannot operate in the way that they will normally operate. So we try to help with all of this. One of the first things that we do is do an assessment together with the authorities, contact the health authorities in the place when we are trying to work, and with them assess the needs of the health system in that area that we are trying to work, and then together we decide where we can support, because there are some things that we cannot do or we don't do, and there are other things that we can do, and the needs sometimes are so big that responding to all of them is almost impossible for just one organization. And what we do also is pass that information to others, like the International Committee of the Red Cross or other organizations that work in similar circumstances than us, if we cannot cover the needs of that specific situation. In this case, apart from supporting health structures, and I will explain a little bit some of the different models of different ways of supporting those health structures, we just found one of the main problems normally is, again, overwhelmed health facilities, too many patients, too little beds, too little staff to take care of all of them. So one of the needs is just to move those patients to another place when they can be treated, when the hospitals are no so busy. And that is challenging, especially in this type of situations, because as you know, there's a lot of security issues when you move around as a normal citizen, but when you move patients that, of course, they need a special support, a special transportation is more challenging. So sometimes we use mobile clinics, big mobile clinics for this, but a mobile clinic will allow you to transport 1 or 2 patients at a time. So in this case, we came with this solution, which is working with the Ukrainian railways. They gave us the opportunity to use one of their trains, and we just accommodate that train to serve as a small mobile hospital where we could transfer those patients to hospitals, and now those hospitals are in Lviv and in the west, and then from there we are moving them, some of them out to Poland, and then from Poland to other countries, again depending on the needs and the type of treatment that they need. This was a first kind of quick setup that we could do. At the same time, we are working in a more with more time. We are preparing a more specialized, another train, which will be much more specialized in terms of what services can provide. Because with this setup that you can see there, one of the pictures is very simple, so we can translate those patients that are reasonably stable, and we are preparing another train that has more capacity to transfer patients that will require a more intensive care support. And we will have both trains working at the same time. One will be for the patients that need more care, and the other one will be for the patients that need less care and can be transported with less medical means. So this is about transferring patients and trying to ease a bit the pressure on the hospitals and the health structures. And the other thing that we do is, for the patients that remain in those health structures, we supply all sorts of medical equipment and drugs depending on the needs. So far, we've been distributing 225 tons of drugs and materials to different hospitals and health facilities. And again, we do that together with the hospital themselves. We contact them, and they tell us what they need, and we just supply them with the items that we can supply them with. There's a limit for everything. Like, for example, as you can imagine, there are very complicated treatments or very complicated medical machinery and equipment that cannot be supply under these circumstances, and then what we try to do is, for those patients, and we are thinking, for example, about certain patients that need treatment for some types of cancer. Those are the patients that we have to move out of the country and just send to to hospitals when they have the big machines running for the scanners or for their chemotherapy, or especially for radiotherapy, which you need all these big machines working. Sometimes in the hospitals in Ukraine, it's not only about the machine being working, it's also about the power supply and other challenges in running those treatment for those type of patients. So again, there's always a limit, and what you try to do is assist in place or in the spot where in the health facility where the patients are, those that can be assisted there, and the ones that cannot, just try to transfer them to a safer place when they can receive the treatment that they need. We are also doing, like in Kiev, we are working with some hospitals and this is an area of expertise in MSF of what we call mass casualty training. So when there is a big event, it could be just one of the big cities, or especially one of the big hospitals that is been damaged because of war and can no longer run as expected. We have a way of responding to that, just setting up a number of temporary structures, and also how to provide the urgent medical services to the number of casualties that you expect in case of a big incident. So we are training the staff together with the Ministry of Health on both how to respond to the medical response to the patients, but also how to set up, and we are providing the setup of the, of the alternative health facilities. For example, we have containers, a normal container that you see, to transport goods. Some of them have been transformed into operation theaters that they can be set up with generators almost anywhere, and just provide that surgical services that you won't be able to run in the hospitals if they are affected by the conflict. In other places like Kharkiv is more simple services. So we are doing primary care. So we are taking care of, the most common diseases like, I don't know, respiratory diseases or skin infections, diarrheas, pain management for the people that are in the shelters underground, and we have services that they do kind of rounds every day, and they just find needs. So they just do an active survey of what is the health situation of the people just in those shelters, and we just provide the response according to those needs. And of course, as I explained before, we work with the refugees which are outside, and we will talk a bit about that later on the people that have crossed the border, but also with IDPs, meaning we monitor the situation all the time, and together with other international organizations in this response, there's a lot of information sharing. So every day there is a meeting in the morning, this well in UN, all the UN agencies, all the NGOs just came together to a big information meeting with all the information about the needs that we found through our surveys, through our information channels are shared, and there's a decision on who can respond to that. So this big information session follows also these population displacements and assess the needs of the populations displaced, and that's a big part of the response of that. In that response, we include health services, but also things like water and sanitation and food, and what we call non-food items, which is things like clothing and even things to carry on your belongings and basic needs that you need to move on to wherever destination you go. So again, first and foremost, support to health structures, but also keeping an eye on the situation of populations that are on the move as well, to see what the needs are and try to keep them as healthy as possible until they reach their destination. Next one, please. This is just to give you an idea very briefly, because again, it's just could be very long to explain, but we've developed, MSF has been working in conflict zones, as you know, for many years, since the beginning of the organization. That was actually how the organization came about. And we have developed expertise in a number of areas. One of them is trauma care, so caring for the patients that have received some type of trauma. And we are developing this as we, year after year, learning from what we do and what works and what doesn't work. And what we found out, for example, in the last years in Iraq and Syria in our interventions, very similar to what is happening in Ukraine now, is that instead of focusing, let's say the way everybody worked before was focusing on the health structure, just trying to provide all the services there. But what we found is there was this big study done together with WHO and the International Committee of the Red Cross, and we look at the mortality of the patients that of trauma patients that needed care. And what was found is that the whole chain from the point where the trauma happens to the last point of care, it was as important as those points of care themselves. So before we focused a lot on the points of care, and we didn't focus so much in the rest of the chain, so to speak, like from the picking up, finding those patients, picking them up, stabilizing them in the point of where the trauma happened, and that transportation, that transfer to the health facility when they could receive the care. And that first response in where the problem happened, and that transfer to the point of care was as important as the support that we provide at the point of care. So now the intervention focus on all these aspects. So we not only provide support to hospitals and health structures, but we also work training the staff that will do that first response, and also providing a proper medicalized transport means to be able to stabilize the patients and to get them as safely as possible to the health facility. Next one, please. Another big problem in these situations, as you can imagine, is, we're talking, and that's what you see in the news, all this spectacular response to, it's more spectacular when you see patients with trauma or wounded, and you see the doctors operating in the surgical theaters. So that is what we understand immediately the need, but sometimes there are things that we don't see and they are more difficult to understand. And it's simple things like, how do you continue treating patients with chronic diseases, right? Nowadays, we have a high prevalence of diseases such as diabetes or high blood pressure or some heart conditions. And you need medication for the rest of your life just to keep you as healthy as possible. And that medication, of course, in situations like the Ukraine now, is not so easy to obtain anymore. So it's challenging for the patients to obtain the medication, and it's challenging for the organizations that provide aid, such as ours, to first locate the patients, and second, make them give them the medication that they need. So what we decided to do in Ukraine is we established a number of what we call hotlines, which is, the name of a hotline explains it itself. So there are numbers where the patients can call, and there is an assessment done over the phone, and there is a response. Normally the response is just providing them with the medication they need. Sometimes the problem can be solved over the phone. Sometimes it's just a question of medication, and we just provide the medication we make the medication arrive to the patient. That's part of the response. The other one is also strengthen the self-care. For example, in the case of diabetes, there's a lot of things that can be done that will make the need for the medicine, the need for the drug, a bit more easier to manage. So you can do with a different type of medication. You can change sometimes to oral medication, so you can manage better your condition just with things like hygiene, a bit of changing your nutrition habits, so whatever is available, because again, all these solutions have to be adapted to the difficult context that the patients are suffering. Equally as the trains, and this is something that we develop over the years as well, we have a number of mobile clinics that work in different parts. We work with them in different parts of Europe as well. Some of them provide basic primary care to refugees coming from Syria, refugees in the situation of refugees in Greece, and also some programs that we have in Europe, for example, working with specific at-risk populations like drug users and populations that normally don't access the health system. So we take the health system to them through these mobile clinics. So we are using some of these mobile clinics now for the same purpose in Ukraine. And as I mentioned, telemedicine is nowadays most of the phone systems are working still, and even sometimes it's through a proper phone call, other times it's just through texting, just trying to first locate the needs and second respond to those needs as better as we can. Next one, please. So again, this is what we do in general. The way we work, and this is so you can have an idea on how we provide all these supplies to not only to the health facilities that we support, but to our teams, is we have this big health facility this logistic facility in France, and we have a smaller ones across Europe, and we have organized everything in what we call kits. So, you know, if you need to support, I don't know, let's say a trauma unit in a hospital, you don't have to go there and make a list of the 200 items that you need, including drugs and surgical instruments and whatever it is. So we have for example, a trauma kit for 1,000 patients. So in that trauma kit for 1,000 patients is everything the hospital needs to treat those 1,000 patients. So you normally assess the needs and you call and say, I need 2 or 3 or whatever many you need. And like the trauma kit, we have a primary care kit, we have a wound kit, we have a burns kit, we have a lot of kits that are already prepared and pre-packed in that facility in France and can be sent to wherever we need them via normally planes or trains or whatever means of transport are possible. And again, this is to support the health structures, but this is to support our teams in the response. We the challenge with sending all this type of of supplies is not only have them ready and send them within the reasonable amount of time that they are required, but of course transportation is a big issue. Logistics of transportation are quite challenging now in Ukraine, and that is one of the big challenges that we are facing, how to make them arrive to, especially to certain places where the security is not guaranteed. Unfortunately, and as we know, lately, part of the conflicts, like the case of Syria, the case of Iraq, and now the case of Ukraine, there is a lack of respect of international law. Humanitarian teams are not as free as they should be, just to provide the humanitarian need that is needed. The populations are used sometimes as part of the different interests in the war, and this difficulties the humanitarian access to these populations and to provide the humanitarian need that is needed. So first and foremost, of course, we have to be mindful of those risks for our teams. Otherwise, it will be even more difficult to provide humanitarian aid if there's a big problem with humanitarian organizations suffering the consequences of that insecurity. And another problem that we are facing is also that all this situation creates a huge demand in supplies, equipment, medicines, and other items that we need. And apart from the increase in prices is the availability of those items, right? Sometimes they are not producing enough quantities, and some of them are already stocked, but in the case of some medicines, they could not be stocked for a long time because they get destabilized, or they have a long shelf life. So they have to be almost kind of produced and used, and that is another challenge. There are some items that are being scarce, and it's difficult to procure, or if you procure them, the prices have been just put up, and there is less quantity that you can get with the same means as before. There's a lot of work done with WHO for this, and yeah, there is a good work done in terms of trying to keep prices at a reasonable level. And there are other treatments that will be super expensive to procure or to send to Ukraine, and those are the ones that for those patients, we are trying to get those treatments outside Ukraine in facilities that are willing to collaborate and receive those patients. And the last problem, and one that is taking a lot of time and resources for our teams, is just preparing as well for certain events like chemical or what we call chemical or biological events. And I say events there, with inverted commas, because it's not only that that we are preparing for possible use of this type of weapons, but also for accidents that can happen during, during the attacks to certain structures, or even accidents that can happen and can cause a spillage of chemical or biological agents that are already in Ukraine in certain facilities and can cause serious problems for the population and for the team. So preparing for this, to respond to this type of events, is, apart from costly and very specific, is very time consuming, and it distracts from, from providing other types of responses. The time and the resources that you have to dedicate to that are quite high and quite intensive. So yeah, we could be much better and we could do much more if we didn't have to be thinking about this most of the time, but unfortunately we do. So that's another of the challenges that we are facing in this crisis. Next one, please. So very quickly, in neighboring countries, what we are doing basically is the same, supporting health systems. So there are health systems sometimes that are already challenged in many ways, like all the health systems in the world. They are challenged nowadays, especially after COVID. And what we do is just support them in the same way that we support the systems inside Ukraine. And also, we have to think that not only neighboring countries, there's a higher need due to the excess of population that they are receiving. And we can think in the case of Poland, when the increase in the population was more than significant, but also is what is happening around the world, right? So this type of crisis not only affect first and foremost, of course, the people in Ukraine and then people in neighboring countries, but there's a repercussion all over the world. So also because of that need or higher demand of certain type of drugs, then we are challenged to find those drugs to run the programs that we run normally in many other countries. And TB, HIV is a good example. And another one is the availability of vaccines and the normal vaccination programs that have been disrupted by COVID-19 and by events like the one in Ukraine now, and that has caused a dramatic decrease of the coverage of normal immunization programs in most developing countries. There's, as I was mentioning, there was a shortage of some products, and again, this affects everybody because the ones that don't need an extra surplus of those items will pay a higher price for the items because they are in more demand than ever. So this affects a lot, especially developing countries where they have a very, they walk a thin line between normal supplying the systems on a normal situation and now having to supply the systems with the same quantities but at a higher price. And that normally causes less patients be treated because normally there's no more money available. It's just less supplies that you can get and therefore less patients that you can treat. So again, the repercussions are, we can think globally and we can have a discussion on what the consequences are around the world. Last one, which is next one, which is here in Austria, we just had the look. Oh, sorry, I thought it was another one. I just finished and let Otto just explain you or talk to you about this thing. But in Austria, I went with a colleague to have a look around Vienna, visit the organizations that are working with the refugees that are here, and we just found that the needs were well covered by organizations. You mentioned them before, the Red Cross and especially Caritas. They are doing very good work. Train of Hope as well. They are doing a very good work. So we just didn't find many needs. Two that we identified. One was psychological support for the patients. There's no enough programs, probably no enough well-organized programs, and that is something that we have raised with a couple of organizations, and hopefully we are working on that area soon with them. And the second one was for what we call third-party nationals, which were people that are not Ukrainian citizens that were in Ukraine studying or working, and they had to leave the country as well. But as not having the Ukrainian nationality, didn't receive the same support and the same protection as the Ukrainian nationals, and that's a problem that still needs to be addressed nowadays. I leave it here. I think I spoke too much. Sorry about that. I leave Otto do his part, and then we can have a chat or happy to answer whatever questions you have. Thank you.
Thank you, Luis. I would like to refer what Solomiya told me. The most important thing is that people or donors and all the employees standing behind your donation, that they are opening their hearts and that they are seeing the need of the people. So the most important thing is this social and humanitarian attitude. And of course, at the end, it comes to the practical thing, and this is a donation. It is also the best way to support our work, what Luis now presented to you. And there, every euro really counts. And I can assure you that your donation arrives at the Ukrainian patients. We see it that you give us in principle trust, and we highly appreciate this trust, and we are really thankful for this, and we have a lot of respect to get this trust in our work. So it is, we see it as our obligation to give back transparent information. We are very open. We are audited. We, of course, have the Spendegütesiegel. It's a certificate. We have the annual report. We have information on our Doctors Without Borders website. We are in all the social media channels. We are on the typical media. And we are open to inform. So if you have some questions, we are ready. We are also self-critical. We are evaluating our work constantly and try to improve. And we are almost 100% financed privately by individual donors, by employees, or by companies, which means that we are independent. We are not dependent on, let's say, government money. This is a big advantage for us, so we can freely decide on our values and on our core mission. So, of course, but this means that we need donations to provide all those medical help. And logistics, as Luis mentioned, is a big topic. Professional, international, organized logistics. I think around half of all the employees are working in the logistics that the doctors and other medical professionals can work. More than 80%, at the moment it is 81.4%, of every single euro is going into the mission. We have only 3.4% administrative costs. Why is this so? It's because that we have a self-obligation that minimum 80% must go into the missions. For example, if we get a 20 euro donation, we can buy sterile materials to treat the wounds of around 6 patients. It's just that you see that also smaller donation has an impact. So to summarize, it's your donation is arriving at the Ukrainian patients. Your donation is necessary and it has an impact. So with you and your donation and a lot of other donors, you make a difference. And not only with your donation, but also with your humanitarian attitude. So from my side and from the whole office of MSF here in the Taborstrasse, we give really big thank you to Solomiya, your vice president, the whole Ukrainian community, all the people that are now collecting money, and every euro counts. So really a big thank you to all of you. So far from my side, and I would like to hand over to Luis or Stephen.
Thanks again. Really insightful. Like we mentioned, as said, we want to give the opportunity to the floor as well to raise any questions if you have any. So I see Solomiya has the first question. Why don't you start off?
Thank you very much, Stephen, and thank you so much for the presentation, Luis and Otto. It is truly impressive what your organization is doing. I learned a lot. I knew, of course, what your organization is standing for, but now very concrete examples, very concrete services, very concrete also consideration of very concrete risks and complications, difficulties that you are facing on your way to deliver your assistance and support quickly. So I wanted to ask you, we know that the crisis in Ukraine has been unfolding very rapidly, and in such situations you need to be extremely well prepared and to very quickly, you mentioned, Luis, you were carrying out some assessments in cooperation with your partners in Ukraine, international partners. But my question is, do you have a kind of a programmatic document that helps you? Do you have a concrete program with that foresees very concrete elements, components that you will focus on in a specific country, and also funding need for that purpose? Because I can imagine you have mentioned medical supplies, non-medical supplies, mobile hospitals, medical services. It's extremely expensive. How do you manage to be efficient, and are you acting based on this on any programmatic document, or it is very rapid assessment that you do and you deliver quickly to the people in need? So that would be the first question. Second question, I was very glad to hear that you collaborate with the WHO. I assume maybe also with other international organizations. You mentioned about your particular work in undertaking assessment in hospitals and how to this trauma centers aspect that you did assessment together with WHO. I think coordination is a key. This is very, very important, and maybe some takeaways from that, because, you know, international, now I am speaking in the capacity of the UNIDO staff. We are also trying to learn our lessons, how to coordinate efficiently, how to make sure that we do not replicate activities of other partners, deliver the right service at the right moment to the right target group. How do you manage that part, this coordination part of your work? And just very quickly, the third question, it is more practical one and relates to Austria. In the first days of this crisis situation, that we also understood here in Austria that we might need to support some patients, and there were private, of course, requests. I received a number of calls from people who need cancer treatments and all these things. And now we were discussing back at that time that there is an interest on the side of the Austrian hospitals and very clear readiness to receive patients from Ukraine, but the problem was the logistical part, those obstacles that you have to make sure that you transport people in the right way, and you select people, you identify those patients, you know which hospital in Vienna or somewhere else in Austria can help. And there was an idea to set up a coordination mechanism again, how to make sure that the government of Austria, the government of Ukraine, ministries of health, and organizations probably like yours can collaborate in order to organize such initiatives. Maybe you have it already in place, but I was not aware that it is functioning, whether it is functioning in Austria. Because with some of the hospitals like Lorenz Böhler Spital, we tried to do it, but this mechanism was not in place. So private initiatives do not bring a lot. It has to be, they bring a lot, yes, but in order, if it is a coordinated effort, it functions much better. So that would be just the third question which I wanted to ask. I have many other questions. It was incredibly interesting, but I leave it here and we can then continue in discussions outside this webinar.
Yeah, thank you. Thanks, Solomiya. Yes, so the first one is, we normally work on needs assessment in this case. So depending on the need, we just adapt to that need. Of course, the organization is prepared for, again, for basically almost anything medical to a limit, because the limit is that is things that are either too complicated or too costly. And for example, you can spend all the money in, I don't know, in a radiotherapy machine, so in a machine to treat, cancer, and then you put it in place, and then somebody drops something funny and bye machine, and you lost all your money. So again, the response has to be adapted to the needs, thinking not only the medical need, but the context where you work. And that's basically what we do. So for example, as I was explaining, we have experience from previous similar situations. So in this facility that we have, when we have our kids, we have a lot of them prepositioned, and we will, for example, have more of the ones that are, in our experience, more used, like the trauma kits and the burns kits and all those kits to support the response to the patients that you expect. Because it's very well known when you have a situation like this that you know exactly most of them. We can even quantify, we can even say without a very small margin of error, from every 100 patients that will need assistance, how many will be trauma patients, how many will be burns, how many will be, primary care. And then what we do is just, again, assess those needs that we try to do quickly. And in the case of Ukraine, it has been quickly because we have our Ukrainian colleagues there that, of course, they can tell you just almost instantaneously what is it that they need, and then that makes things more easy. So yeah, based on needs, the request is adapted to those needs, to those limits that I was explaining with the example of the cancer treatment. The coordination is one of the UN responsibilities. The UN agencies have certain mandates, and one of the mandates is coordinating this response. So as I was mentioning, yes, there is this humanitarian meeting where UN and UNHCR coordinates a daily meeting where one representative from each, at least one from each agency, meets together, and it works both ways. So everybody shares the information that they had, and then there is a kind of list of needs, and is decided who does what. And normally each organization specializes in an area, like ICRC, for example, does looking for getting information to assess the legal aspects of the war, if the rules are being followed or not. Looking, for example, for families that have been lost in the movement, and reuniting families. So every agency has a number of activities that they specialize. So normally the organization of functions comes quite naturally, because also we know each other very well, because when this happens, it's just a few organizations that remain, especially in Ukraine, and they are the Red Cross, ICRC, MSF, and the local authorities, UNHCR, obviously, and WHO. And with WHO, yeah, it's a very good example in all the procurement of drugs and all the procurement of medical equipment. They have a very important role. Also, the monitoring of the health situation and calling for support. And linking that with the first one, because you were mentioned about the needs, and it's true, it's high needs. Fortunately, as you were mentioned also in the introduction, there has been great solidarity with this case, and we are receiving, like any other organizations, we are receiving a lot of donations, and those donations for the moment are good enough to cover the needs. The problem in these conflicts, what it is time, right? So is donor fatigue, what we call donor fatigue, which is at the beginning is on the news every day, everybody's looking at it, and everybody's happy to help. But then with time, people forget, or they move on to other things, or they move on to the next conflict, and then is when it gets complicated. So maintaining that response over time is the complicated thing. In this case, we all have our fingers crossed that this will be a short short situation, but by the looks of it, it can, it can be extended in time, and then that continuous response is what is a bit more challenging. And the last one about Austria, you are spot on. There is much needed, and you can count on us. We were trying to do that ourselves. We know, with these patients that we are referring, we wanted to know first what are the needs, to find here the support in Austria, because we can go to the health system in general, but the first thing that they're going to ask us probably is, okay, what type of patients? Because, depending on and there will be the more specialized one, obviously, because again, the simplest conditions will be treated either in Ukraine or in neighboring countries. And here we will need those that are more complicated or have needs that will not be met in those countries. So we will need to know which ones there are to contact the specific services. And it will be fantastic to have a mechanism that will make that possible. So as you said, happy to meet outside this seminar whenever you guys have time and start talking about that. We made some contacts with the authorities ourselves as well. We have the information from our teams there, and with your contacts as well, I think that it could be a joint initiative that we can organize together, and it will be a really good thing to do. So yeah.
That would be excellent. Thank you so much. I would be very delighted to discuss it.
Thank you very much. Is there any more questions from the floor? I'll give you a few seconds to put your hand up. I didn't see anything in the chat either. Otherwise, I have one last thing for you. I have a 1-minute video from MSF as well, which we would like to show in closing. If there's nothing else, I can't see anything. Then I will show the video, and then afterwards we can close the meeting.
Hi, this is Dan Schnorr, emergency doctor for Doctors Without Borders. We've left Zaporizhia on medevac train. We have 9 patients on board, plus family members, caretakers. Patients all have various traumatic injuries that they sustained either in Mariupol or while trying to leave that area. Right now, patients are stable. We just completed medical rounds on our patients and developed a care plan for them. This is our second day on the train. We should arrive in a couple of hours. We just finished checking in on all of our patients. They slept and they're doing well. We're preparing for handover to hospitals in Lviv.
And with that, unless there's anything Otto wants to add to the video?
No, I would like to thank you, Stephen, for this possibility that we could talk about our work, what we are doing. And thanks again to Solomiya for all your efforts. And I wish you a lot of good energy and power. And I'm really looking forward to a closer cooperation, what you discussed before with Luis. And yeah, looking forward meeting you again. And thanks a lot.
Thanks a lot. And also a quick reminder, tomorrow we are having a similar session with the Austrian Red Cross. So hope to see you there tomorrow as well. Okay, thanks a lot and bye-bye.